My name is Sammy Saab, and I'm a professor of medicine and surgery at the David Geffen School of Medicine. I've been a hepatologist for about 13 years here, and my focus is predominantly hepatitis C and liver diseases. So at the recent liver meeting in Washington, D.C., we learned of new hepatitis C drugs becoming available for our patients. These drugs will come in several phases. We have one new medication coming out in just 4 weeks, early December, and this drug will be used with interferon ribavirin. The advantage is that the treatment duration, instead of being 6 months or 1 year, will only be 3 months. That drug will be sofosbuvir, a new direct-acting agent, plus interferon ribavirin. And the cure rates for people with genotype 1 is between 80–90%. So there are some circumstances where you can use sofosbuvir and ribavirin without interferon. And those cases are people with a different hepatitis C type, which we call genotype 2 or genotype 3. There's also studies showing that people on the liver transplant list who are waiting for a short period of time, they may benefit also from taking just sofosbuvir and ribavirin. And patients after liver transplantation, those two drugs, sofosbuvir and ribavirin, without interferon, may also be a reasonable option as well. At the liver conference, there was a whole plethora of data on new medications. There are presentations on a second generation protease inhibitor called cimipivir. The first generation being Victrellis and Incivic. The second generation looks very promising, taken once a day, a lot less side effects than what we saw with Victrellis and Incivic. So that might represent an option for people with our patient hepatitis C genotype 1. That drug will probably be indicated for people who are treatment naive, never treated before, as well as those people who are treatment experienced or patients who've been treated before and therapy didn't work. There's different hepatitis C types or families. In the United States, we're predominant genotype 1A. In other parts of the world, in Europe and in Asia, it's genotype 1B. So that virus is a little more sensitive to medication. So some companies have actually opted to launch their product there first before coming to the United States because their success rate is a little higher with that hepatitis C subtype. So in terms of FDA approval, we believe that cimipivir by Janssen and sofosbuvir by Gilead will be FDA approved in the next 4 weeks. In terms of all oral therapy combinations for genotype 1, we believe that the Gilead products and the AbbVie products will be approved by late 2014 or at the latest first part of 2015. Right, so there are many combinations of oral therapies coming out for hepatitis C, and what we've learned at these new therapies coming out, there are certain criteria. First of all, they're very short duration of treatment, and number two, they've actually raised the bar in terms of cure rate. So now what's expected is these treatments should be no longer than 12 weeks for genotype 1, and the cure rate should be at least 90%. And most new regimens are coming out meet those two criteria. And the third criteria, of course, being few of any adverse effects. The combination that many people are very excited about are the Gilead, sofosbuvir plus a different oral agent from their platform. The advantage of this combination is there'll be 2 different medications in 1 pill. Take it once a day. So inherently there's simplicity. Inherently there'll be very few adverse effects to the best of our knowledge. And thirdly, we're not aware of any resistance to the drug combination. And the cure rate, we believe, will be between 90 and 100%, depending on what population you look at. The Merck products was very exciting to deliver, meaning that really caught everybody by surprise, everybody, including me, everybody. They're presenting great data, but they're a little far behind the game. They won't be out for at least a couple of years. The AbbVie looks very promising as well, very effective medication, very well tolerated, but it's going to be 3 or 4 different medications. So it invites the issues of potential drug interactions, invites the issues of potential side effects as well. So as providers and patients, we're looking for simple strategies that are easy to take, safe, and efficacious. In my practice, and we see the variety of all insurance companies from Medicaid to PPOs, costs have not been a barrier to treat hepatitis C. We've been able to get both Incivic and Victrola approved with interferon ribavirin, so costs have not been a barrier. In terms of future hepatitis C therapy, Cimipivir or Sulfosfir really have no idea. These drugs are not FDA approved yet, and we don't know what the payment will be, the co-payment or the total charges. These companies have already promised to help the patient with their co-payments and have other programs of financial assistance for patients, so make sure they are treated and cured of their viral infection.